This video presentation aims to present a proposal to the administration team and board of directors to implement a patient queuing system at the Diagnostic Center at Woodland Heights Medical Center. The implementation of a patient queuing system significantly advances the patient progression as employees and patients are provided a visual representation of their relevant and approximate location within the throughput process, elevating both patient and employee satisfaction. Some studies have identified a correlation between a lack of technology and infrastructure as it relates to untimely patient health care and how it contributes to overall patient dissatisfaction, therefore perpetuating an inherent stigma in healthcare regarding lengthy wait times and impersonal care. Patient health care and satisfaction should be paramount to the local diagnostic center at Woodland Heights Medical Center, indicating that overall patient satisfaction and quantifiable health care can be improved by streamlining the processes at the diagnostic center using technology. For an example, an improved patient experience can be achieved by implementing a patient queuing system at the diagnostic center, relieving employees from a pen and paper sign-in sheet, allowing an increase in patient throughput. QMiner will improve patient experience, automate repeatable processes, manage employee time, set provable key performance indicators, measure service performance, review service processes, and enable effective communication. If we implement a queuing system and decrease the number of patients that leave to 8% and charge $250 to each discharged patient, an additional revenue of $2.8 million can be generated, increasing the profit margin at the diagnostic center. Follis describes a facility in Texas that estimated to spend $8.12 per patient per traditional registration, and after implementing a queuing kiosk, spent 74 cents to $1.12 per patient per kiosk check-in, saving between $7 and $7.38 per patient. The Diagnostic Center at Woodland Heights Medical Center has a vision to be the leader in patient care while employing those with a caring heart. The mission is to reach patients in the Angelina County and surrounding areas and provide them the best care we can. Our goal is to provide patients and their family with quality care and services. A quantitative approach is objective, concrete, and measured, which prompts the researcher to use questions and build a hypothesis about their study. Quantitative data is generated in the form of a test, survey, experiment, market report, or metrics. Although quantitative research presents statistical data, another purpose of business research is to take this data and convert it into meaningful information and knowledge for use by the organization in order to improve the quality of decision making. Thus, the organization utilizes data to gain knowledge and information. When patients wait for extended periods to be seen, there are consequences the organization faces, such as delayed care, poor patient satisfaction, financial implications, and more. The following are attributed to causes of extended wait time. Patients arrive late for scheduled appointments, STAT, or urgent testing that moves them to the top of the list and moves the next patient in line further down. Unscheduled patients arrive at the diagnostic center and are worked in between scheduled patients. There are also staff shortages and overscheduling causing extended wait time. There are numerous causes of extended wait times that are beyond the control of the diagnostic center. By utilizing a queuing system, the patients visualize their approximate location in line instead of simply speculating when they will be seen. Ovular and Eek define the queue as an example of a linear data structure, or more abstractly, a sequential collection. Queues provide services in computer science and operations research where various entities such as data, objects, persons, or events stored and held to be processed later. Queuing systems are deployed to analyze the arrival pattern of patients, service pattern of servers, or in our case, the employees, queue disciplines, system capacity, number of service channels, and number of service stages. As facilities implement queuing systems, they save time, therefore do not say rates are improved as fewer patients are getting frustrated and leaving. QMiner offers businesses the following products: check-in kiosk, service dashboard, digital signage, TV, analytics, and instant messaging. The QMiner check-in kiosk allows a patient to invoke a personal atmosphere while avoiding confusion. When it is the following patient's turn, the display will highlight their name and play a special notification or chime, and the next patient in the queue will move up in the list. Although there are many queuing systems on the market, the patient queuing system that constitutes the best solution based on the needs of the diagnostic center is the QMiner system. QMiner is a reputable, proven system that has the necessary functionality and HIPAA-compliant features required of the diagnostic center. As mentioned before, with the implementation of the visual queuing system and the added satisfaction of the audible alerts, combined with the text messaging component, the patient experience will be significantly improved. Moreover, with our competitors lacking a comparable technological system such as QMiner, we should also see a significant growth in social satisfaction as the positive changes are propagated in the community. QMiner is a HIPAA-compliant company and has been HIPAA certified. HIPAA, or Health Insurance Portability and Accountability Act of 1996, protects employees in a healthcare facility, patients, students, non-clinical employees, insurance companies, companies hired for billing, and electronic medical records, or EMR systems. HIPAA compliance is a significant law that healthcare organizations, government, patients, and other families take seriously, and so should employees. As a healthcare leader, I must ensure that employees remain HIPAA compliant with any system utilized. Failure to protect a patient is an ethical problem that healthcare organizations face every day and is considered a breach of duty. POSGAR defines a breach of duty as the failure to conform to or the departure from a required duty of care owed to a person. Healthcare organizations have an ethical responsibility to their patients to provide safeguards for the information they collect. Organizations need both employee and organizational buy-in. Buy-in is rooted in the act of an individual or group giving something in return for something else. Buy-in involves one's tangible or intangible return in one's investment. Employee buy-in is essential for the queuing system to succeed. The more buy-in employees demonstrate in support of the change, the more likely the change will be successful and sustained over time. If the organization does not get buy-in from employees, all efforts to get the patient queuing system running will be a struggle. In addition, achieving buy-in depends on timely, accurate communication between the managers and their employees. With financial support from CMS, administration, the board of directors, and the board of trustees, a patient queuing system will help save the company costs, bringing in revenue and increase employee and patient experience. For which of you desiring to build a tower does not first sit down and count the cost, whether he has enough to complete it? Luke 14:28. Several departments will have to help aid in this project. First, the board of directors, board of trustees, and the administrative team will have to agree to implement the system. Then Community Health Systems will have to approve the new system as they own Woodland Heights Medical Center and the Diagnostic Center. Once the queuing system is approved and the finances are in place, QMiner is contacted. QMiner and the accounting department will need to meet to determine the cost of the system and sign a contract with CHS. QMiner will have to help set up the system and provide the tools needed. But the information systems employees will have to aid in connecting the QMiner system to current systems utilized. The Health Information Management Director will also need to meet with QMiner and the IS team to ensure no HIPAA breaches occur. The admissions department is the frontline staff of the Diagnostic Center and will need to have education before rolling out the queuing system and learn how to educate patients on how to utilize the kiosk. From the CEO to the janitor, each employee in healthcare should show a servant leader's heart. Servant leaders are people who feel a deep duty of stewardship to others, their co-workers, their organization, and most importantly, their customers. Scripture tells us that for even the Son of Man came not to be served, but to serve, and to give his life as a ransom for many. Although employees at the Diagnostic Center are not laying down their lives for patients, they do need to have a servant's heart when assisting patients. By alleviating the stress of keeping up with which patient goes where and when, the queuing system will allow employees to serve their patients better and with a better attitude. Patients are frequently required to wait for considerable amounts of time to have a simple test performed. In modern times, when everyone's life seems rushed, people have a difficult time simply waiting, and time appears to flow slowly when waiting. By implementing a patient queuing system, there are improvements during the patient flow as both employees and patients have a visual aid to where they are in the throughput process. I've given much information on how the Diagnostic Center can leverage technology to improve the patient's overall experience and improve the throughput process. Patients are the reason for healthcare, and they should be at the center of it. Thank you.